Good morning. Thank you for starting your day with Good Day Charlotte.
Scientists now sending out a warning about the possible harms of fluoride.
Taking a live look in our green room, we are talking to a doctor about the possible dangers of the chemical. Is it a real thing that you need to worry about, or can we just
brush our teeth in peace
like normal people? 7:38 right now. We're back in 2 minutes. Fluoride has been in the news recently. A new study looking at pregnant moms finding the higher mom's fluoride level, the lower their children's IQ at ages 3 and 4. Scientists have been warning of possible harms of fluoride for years, but on the flip side, of course, fluoride reduces dental cavities. Here to sort all of this out for us is Dr. Deb Matthew, because this is of important significance here to folks in North Carolina, because 87% of North Carolina residents drink fluorinated water.
That's right. You know, we've been adding fluoride to the water for decades in order to prevent dental cavities. And while that's a good thing, there have been scientists that have been concerned, but the studies that they've based their concerns on have been done in China and Iran. They haven't been great studies. So all of the major health organizations have told us it's safe. The American Academy of Pediatrics, American Dental Association, the CDC has told us that it's one of the 10 great public health advances of the 20th century. But a new study has us concerned because they looked at 500 pregnant moms in Canada, and they measured their fluoride intake, and they measured fluoride content in their urine, and they measured the IQ in their children when they were 3 to 4 years old. And what they found is for every 1 milligram per day of fluoride intake, the children's IQ was lowered by 3.5 points. So this has shocked us, and this is of concern.
Wait, per day?
Per day. Now, in Mecklenburg County, we have 0.7 milligrams per liter of fluoride in the water.
Okay.
So if you're drinking less than 1 liter of water, you're still in the safe zone. But we get fluoride from other places, too. For example, tea is naturally high in fluoride. So this is of concern. And the question is, now what do we do?
Right.
So the first...
Because you need those to protect your teeth in many ways, too.
So fluoride protects your teeth. So the first thing is, this is relevant to pregnant moms, right? We're looking at prenatal development. So if you're a pregnant mom, there's no need to panic. You don't have to stop drinking the water. More studies are going to need to be done to prove whether this is, in fact, even true. In the meantime, though, there are some things that you can do to reduce your fluoride intake in order to protect your unborn baby. So one of the things that you could do is you could switch over to drinking spring water. Spring water is naturally lower in fluoride. But if you're drinking bottled water, there's chemicals in the plastic. So now we got to be concerned, are you switching one problem for another? You can do filtered water. And the important thing to know there is the common carbon filters, like on the door of your fridge, and the standard ones that you can just fill and put in your fridge, they don't filter fluoride. So you need to do a little bit of homework in order to figure out whether your filter is going to filter the fluoride or not.
Okay. So you're still getting the fluoride, in other words, possibly.
If you're just using the one on your fridge, you're probably still getting the fluoride. And then the study looked at prenatal development, right? We don't know after the kids are born. We know that breast milk is naturally low in fluoride, so here's another reason why breastfeeding is a good idea. If you're going to be choosing bottle feeding, you might want to mix the fluoride with filtered water until we know different. And if you are going to be reducing your fluoride exposure, you really need to be careful about your kids' dental health. So you want to make sure that you're brushing, you want to make sure your children aren't swallowing fluoride. So the little guys, they don't even need toothpaste. You can just brush it with just the toothbrush.
So do you say don't use fluoride without, use toothpaste without fluoride now, just in case?
When fluoride is used topically, it does help to prevent cavities. We're talking about ingesting it.
Okay, but with kids who are small enough,
so with kids who are small enough that you think they're going to swallow their toothpaste, you can actually don't use toothpaste or use non-fluoridated toothpaste. But it's ingesting that's the concern.
And so for pregnant women, it would still be safe then to use a fluoride toothpaste because they're not swallowing it either, because they, especially when you're pregnant, you're that much more likely to get cavities, right? So is it that much more important, as long as they're not ingesting the toothpaste, to still use a fluoride toothpaste, would you recommend?
I think there's not enough data for us to say don't use a fluoride toothpaste. So I think for now it's okay.
Okay. Oof. You have a final tip here before we go?
You know, don't panic. Studies need to be done. It's a small change in the IQ. This is not an enormous problem, but it has really opened our eyes so that now more research will be done so that we can get more answers.
You are so right. You made the point right when you arrived today that this was the case with lead years ago, right? When
we thought that a little bit of lead was okay, and now we've decided really no amount of lead is okay. We don't know about fluoride, but we're going to find out.
But we're going to find out. There you go. And better safe than sorry, right, in a lot of cases. Dr. Matthew, thank you so much. Always great to have you in, weighing in and providing a little perspective for us here.